Am I audible? Okay. So, hello everybody. Welcome to this webinar on the first ever European Cardiovascular Health Plan, the EU Safe Hearts Plan, an important step forward for public health in Europe and a real opportunity to drive meaningful change. My name is Chantal Mathieu. I'm an endocrinologist in Leuven, Belgium. And I am the president of the European Diabetes Forum. If I may have the first slide, please. The European Forum is a policy forum where different stakeholders are coming together to speak with a harmony of voices and really amplify our voice defending diabetes on policy level and making clear to policymakers, researchers, clinicians, how important diabetes is. We have campaigns that we perform. We focus on the importance of access to novel technologies, the importance of data and registries, the importance of integrated care, and also now the link between diabetes and obesity and the possibility for early detection of type 1 diabetes in pre-symptomatic stages. As such, we are involved in different projects like the Identify project and IHI public-private partnership, where we are testing different models for screening of early stage T1D, and the Jakarta Joint Action on Cardiovascular Disease and Diabetes. In the next slide, you will see our members. I, for instance, am the past president of ESD and EFSD and represent ESD and EFSD together with Francesco Giorgino, the now president of ESD in the European Diabetes Forum, but also the Foundation of European Nurses in Diabetes, Breakthrough T1D, IDF Europe, ISPAT, Primary Care Diabetes Europe, and La Société Francophone du Diabète are members of the EUDF, together with supporting collaborators from industry. So again, a harmony of voices to bring diabetes to the policy forum. Next slide. Today we organize this webinar to really bring to the forefront the European EU Safe Hearts Plan and discuss with you the importance of now bringing the content of this plan to the individual countries, because as you know, healthcare in Europe is driven by the countries. And cardiovascular disease remains the leading cause of death across Europe, and many of these deaths are preventable. And this is recognized in the Safe Hearts Plan and sets out a comprehensive approach from prevention and early detection to treatment and long-term care. As discussion now move forward at the political level, we must ensure that one message is clear: cardiovascular health does not exist in isolation. Diseases like obesity, diabetes, and related conditions are deeply interconnected with cardiovascular disease. They increase risk, shape outcomes, and must be addressed together. But the plan also acknowledges this interconnectivity and the fact that diabetes and obesity stand alone as important diseases with their own problems. The diabetes and obesity community takes on the responsibility to ensure the recognition of these diseases as such, diabetes and obesity, but also as risk factors for cardiovascular disease. And thus we, as a community, have a crucial role in helping to translate this initiative, this EU initiative, this Safe Hearts Plan, into concrete action at country levels. We must advocate for an approach that addresses all types of diabetes, recognizes obesity as a chronic disease, and pays attention specifically also to the younger generations who are increasingly at risk of diseases like obesity and diabetes. Importantly, we should also have attention for diseases in cardiovascular health like familial hypercholesterolemia, where you have a genetic condition underlying an extremely increased cardiovascular risk. Or diseases like type 1 diabetes, where you have a polygenic background, again, affecting people early on in childhood and young age, and that has a dramatic impact on later life. And thus we will join forces between all of these communities to really make a difference in cardiovascular outcomes in Europe. Diabetes and obesity should be integrated across the entire care pathway, as said, not only as cardiovascular risk factors, but as serious chronic diseases in their own right. And we are grateful to the European Commission and specifically Commissioner Várhelyi for having laid this foundation, but now it's in our hands. We will be responsible for helping the implementation of this plan and this approach in our member states. And this is why you are so important. We will all play a role in this. And so today we want to really explain the plan and discuss with you how this can now be implemented. Today will be about learning, sharing expertise, and equipping ourselves to engage national and local policymakers so that this plan really delivers impact. And together, I am a true believer that we can turn the Safe Hearts plan into lasting improvements in prevention, in good care, and outcomes across Europe. Thank you all for being part of this important conversation. As you can see in this program, I will be handing over the chair to Mr. Bart Torbijns, who is the Managing Director of the European Diabetes Forum. And I will also invite Mr. Nikos Manaras from Acumen Public Affairs to share the floor with Bart, because Nikos will guide us through the EU Safe Hearts plan in greater detail and share practical insights on how we all can help advance its implementation in our respective countries. This webinar will be recorded so that you can all re-watch it and look at all the details you may need to help implementation in your countries. However, before I hand over to Bart and to Nikos, I will invite you to watch a short introductory video explaining already briefly and visually the Safe Hearts plan and its key priorities. Thank you very much. And indeed, as shown here on this slide, do visit our EUDF website. You can access it by scanning this QR code. Before handing over to Nikos, I will remind everybody that throughout the webinar, you will be able to ask questions through the Q&A feature of the Zoom. And at the end, we will try and answer as many questions as possible. If not, please put your email into the Q&A and we will get back to you after this webinar. So Nikos, please take it away.
Thank you very much, Professor Mathieu, and good afternoon, everybody. My name is Nikos Manaras. As Professor Mathieu mentioned, I'm a partner and the head of the healthcare practice at Acumen Public Affairs. We are a Brussels-based public affairs agency, and we have had the pleasure of working with EUDF over the past few years on a number of projects, including obviously the working together towards a diabetes position, a diabetes community position for the cardiovascular plan. So it's a pleasure to be here. What I plan to do over the next few minutes is to take you through the plan. I'm not going to cover every aspect of it because obviously it covers a lot of things. So we've worked with EUDF to select some initiatives to highlight that are mostly relevant for the diabetes community, but also just to clarify that there's a number of other initiatives, and those that we will not be covering today are those initiatives that are particularly linked to flagships that are linked to health disease prevention and health promotion. So, for example, anything that has to do with tobacco, alcohol, and food, we're not going to cover today. So let's just already dive into the details. But before we do that, just to kind of like understand where this plan is coming to and where does it fit in terms of what the EU can do, what are the responsibilities, if any, for the member states. Just as a reminder, obviously, health policy is a responsibility or a competence, as we say, of the member states. The EU is responsible for providing support through coordination, funding, collaboration, sharing best practices, etc. What the EU regulates or legislates on health-related areas is anything that affects the internal market, so anything that has to do with pharmaceuticals and medical devices, so authorization of medicines and medical devices, as an example. However, national health policy, the organization of national health systems, is an exclusive competence of the member states. This is why the EU Safe Hearts Plan that was published on the 16th of December is basically a strategy. It's not law. It's not something that adds any obligations to the member states. So since this is a non-legislative initiative, it also means it's non-binding for the member states. It provides a framework that can guide the member states and can provide support if they choose to proceed with certain activities, which also means that the success of the plan and the initiatives that the plan will put forward depend very much on the interest and the uptake of the member states, which by itself can also be generated by the activities and the push of the communities at national level. So there is a lot of work that still needs to be done at national level so that some of those initiatives actually have a positive impact for the community. So let's go to the next slide just to see a little bit of the overview of the plan. There are three main pillars to the plan: prevention, diagnosis, and treatment. On the prevention side, and again, here's a summary version, obviously. So there is the prevention element. So these are the initiatives that I mentioned at the beginning that we will not go into more detail later on. So all the initiatives that are looking to address unhealthy behaviors, to reduce risk factors for cardiovascular diseases. There are some initiatives included in there, as I mentioned, around alcohol, tobacco, and food, and obviously some initiatives around promotion of physical activity. Then there's the element of diagnosis, and this is one of the areas that the plan has put a lot of emphasis on. And this is where we will focus later on because there are some flagships, as they're called, on early detection and screening. Primarily, what we will be looking at in a few minutes is that upcoming EU protocol on health checks for cardiovascular diseases that obviously to the interest of the community will also be is expected to cover diabetes and obesity. Then there's the element or the pillar on treatment. There are specific initiatives within the plan to enhance management and care and rehabilitation. There are certain policy levers and instruments, and we'll go through them in a little while. There are also cross-cutting themes. Obviously, across the plan, there are several elements linked to digital innovation, advancing research in the area of cardiovascular diseases, but also in the interconnected areas of diabetes and obesity. And here, just as a parenthesis, because Professor Mathieu referred to that at the beginning about the interconnectedness of those diseases, also, the commissioner in the presentation of the plan talked about the triangle of cardiovascular diseases, diabetes, and obesity. Then the last thing that I wanted to highlight about the plan is that the plan also puts forward EU-wide targets. Those targets, basically, as it refers to diabetes, for example, they say that 65% of people living, 65% of people between 25 and 64 years old, and 80% of people over 65 should have their blood glucose checked once a year by a healthcare professional. Similarly, this is how the cholesterol and the blood pressure targets are included in the plan. So it's percentage of population to have their cholesterol, the blood pressure, the blood glucose checked by a healthcare professional once a year. So these targets are mostly linked to health literacy awareness and the relationship between the citizen and the healthcare system. These are not targets that are linked to mortality and morbidity. These are not targets that are linked to treatment. These are not targets that are linked to outcomes. These are not targets that are linked to anything else. The reason for that is obviously because the EU cannot, it's very difficult for the EU to set targets that they cannot control. That links back to what I was saying before about the competencies of the member states. But that doesn't mean that these targets are the ones that will be replicated at national level. And this is why this is where the link to the national plans we're going to talk about later on is very important, because then member states can set their own national targets when they put national strategies in place as a follow-up to the EU Safe Hearts Plan. Now, before we start going deeper into the some selected initiatives from the plan, just very briefly, why a cardiovascular health plan matters for diabetes. First of all, and we can go to the next slide. First of all, there is a clear recognition also in the plan about the interconnectedness of diabetes, obesity, and cardiovascular disease, that triangle that I mentioned before. The plan itself can also strengthen prevention. There's, as mentioned, a lot of initiatives around prevention, but it also puts forward policy opportunities that we will look at in a bit, that can help improve treatment and care for people living with diabetes. They can improve screening and detection of diabetes, and can also drive innovation and research for diabetes care. Now, as I mentioned, the success and the impact of all that we're going to look into in the next few slides and are part of the plan really depend on the activation of the community and the engagement of the community with the policymakers at national and European level in order to ensure that those documents actually, those initiatives actually deliver for people living with diabetes. So let's start going more into the details and of specific initiatives. The first one to highlight is the EU Cares for Your Heart initiative, which basically is the work that the Commission will carry out in order to create a framework to guide the member states to develop national plans. We understand that most likely this is going to come through a joint action similar to Jakarta that some of you might be familiar with. So what that means is that the participation of the member states is again voluntary, which also means that there is a lot of need, that there is a push from the national level towards the ministries of health to participate in that joint action, out of which there will be a framework and guidance for member states to develop national cardiovascular health plans or cardiometabolic plans, or plans that at least cover that triangle that we were mentioning before. The additional opportunities, obviously, and what does a plan change also at national level is that then obviously that signals political priorities that can also steer national funds towards screening programs, towards treatment, care, and reforms at health system level that matter for people living with cardiovascular diseases, diabetes, and or obesity. But also at the same time, prioritize the removal of policy barriers that might be limiting access to care. How do we expect this to play out over the next few months? As I mentioned, the understanding is that this is going to happen through a joint action. This is this is a program. This brings together the member states through either their ministries or public health authorities, and they participate in various work streams that are coordinated usually by one member state. The thing is that also doesn't necessarily mean that if a member state wants to develop a national plan, they have to be a part of the joint action. I also need to separate the two. But at the same time, the involvement in the upcoming joint action on this will signal the appetite of a member state to get active and produce a plan, a strategy later on. For you to be aware, the EUDF has developed a shadow plan, an EU shadow plan that will be linked at the end through a QR code at the end of the presentation that you can access, based on which you can also build a similar blueprint at national level. There are already member states that have national plans or are in the process of updating their plans, or there are member states that wish to develop those plans. Engaging with the ministries and by getting them to participate in the joint action that will deliver that guidance for the member states, but also working with them with developing your own shadow plans at national level and engaging with the ministries and working with the ministries together is what should be one of the priorities over the next 1 to 2 years, because we expect that this together with the council recommendations on the health sector that I'm going to touch upon in a second, will be the two key priorities of the Commission and the member states as regards the EU Safe Hearts Plan over 2026 and 2027. These are the two things we expect them to focus on the most. Let's go to the next one. And the next one is the one that I was mentioning before, which is the EU Protocol on Health. Here we have a different policy instrument. Before we were talking about the joint action. This is what is called a council recommendation. This is a document that is initially drafted by the Commission usually after consultation with the member states. And the expectation is that this consultation with the member states will happen through the public health expert group of the Commission, where the member states also send experts from the ministries or other public health institutes. And also together and in collaboration with the OECD, which also tomorrow is hosting a webinar on the health sex. They will work together to develop a draft council recommendation on what the member states could potentially screen for, and at what ages, or age brackets rather, what funding can be used, what structural changes might be needed at health system level in order to improve screening and diagnosis for cardiovascular diseases, diabetes, and obesity. The document that will be developed by the Commission will be a draft that will be then given to the member states in the Council here in Brussels to negotiate on it, adapt it, amend it, and finally adopt it. The timeline for this, we expected, the Commission has already kicked off the work. As I mentioned, tomorrow already the OECD in collaboration with the Commission are hosting a webinar on those health checks. So they will start the work. They have announced that the draft will be ready towards the end of this year and then given to the next presidency, which most likely will be, which means that most likely this will end up with the Lithuanian presidency at the beginning of next year, or if the document is a little bit delayed, with the Greek presidency second half of 2027 to negotiate it in the Council. There are a couple of things that I want to highlight because this provides key opportunities for the community. Even though this starts, and this is also coming from a discussion that we had with the EUDF and the Commission in a previous meeting, even though this comes from under the umbrella of a cardiovascular plan, this doesn't mean that this is not relevant for diabetes. And it's not just relevant for type 2 diabetes, which is the most evident one for someone when we're talking about cardiovascular diseases, but there is also the opportunity to include their policy asks related to screening and diagnosis for type 1 as well. And this is why it's also linked, and Professor Mathieu made also that link also to FH, because with the exchanges also with the Commission, there is an understanding that there might be different recommendations for people at younger age, so childhood, adolescence, and then adulthood. So across the life course, what should people be screened for? And that would be either through a systematic approach to screening and or opportunistic screening at primary care level. It is still very much tabula rasa, if you allow me to say it like this, on what the Commission will put on paper. That will be the starting point for the negotiation, which means that at the same time, this is a very big opportunity to shape the content of that document, because that document can then be used at national level to develop and implement national screening programs and national screening protocols using the guidance that will be included at the EU Council recommendation on the health checks. How you can engage at national level at the moment is, first of all, again, with the Ministries of Health, to highlight the importance of this document when it comes out and prepare them for the upcoming negotiations, because you will have member states that are much more in favor of systematic approach to screening, but you will also have member states, as you know very, very well, that might be way more conservative in their approach and the guidance that they are willing to accept from the European Commission on something that is national competence. Let's move on to the next one. There is also a flagship on closing the research gap, in order to the research and innovation gap, as it's called in the plan, in cardiovascular diseases, by providing specific funding through Horizon Europe, but also other initiatives in order to improve the current situation. So this is why the Commission will start launching specific programs or specific projects or calls for proposals through Horizon Europe, EU for Health, and other funding mechanisms. Now, this is relevant both for the current financial program that runs until 2027, but this is also important for the next financial program that starts in 2028, the so-called MFF, the Multi-Annual Financial Framework, also known as the EU budget. So the importance of this is that with the plan in place, this signals that there will be funds available in those areas. But the types of projects and what will be prioritized under that umbrella of what type of projects do we need to fund in order to close the research and innovation gap will again be an outcome of your engagement with the Commission specifically on how to shape those calls for proposals that will be coming up. So this is a call to watch the funding space, both from the current cycle and the upcoming cycle, and also think of what are potential projects that you would like to engage with the Commission on to push that should be funded through some of those available funds. To clarify, here I'm talking about funds available for organizations, for civil society, to run projects, to run research projects through Horizon, through IHI, together also with other partners in broader consortia, etc. Just as a side note, there is also the funding element at national level, because a lot of those things, whether we're talking about a national plan, a screening program at national level, or any structural reform or any type of reform to improve diabetes care, for example, at national level, could benefit from European funds. That's another very, very big discussion that can follow, but there are available funds for the member states already from the existing financial cycle and the upcoming one that can be used outside of specific health budgets. And I'm referring here to cohesion funds, for example, or you might be familiar with the recovery and resilience funds that can be and have been used to put in place some of those initiatives at national level. Let's move on to the next one. If we can go, and this is about personalized treatment. And now we're starting to get into the initiatives that we expect are going to be in the second half of this mandate. So we are talking now of timelines of them materializing beyond the end of 2027. This is yet another Council recommendation. So it's the same policy instrument with the one that I was referring to about the health sector earlier on. And this is something that is not as mature in terms of its thinking and what it will include compared to the one on the health checks. What the Commission has announced is that this Council recommendation will aim to enhance the quality and consistency of personalized, integrated care pathways for cardiovascular diseases and related conditions. As you can imagine, this is very, very relevant, obviously, for the diabetes community. And as a reminder here, the EUDF, and Bart can talk to that, I think, later on, has done also quite a lot of work on developing policy recommendations for integrated care for people living with diabetes. So even though this initiative is not yet very mature in terms of what it will include, and it will come later on, this means that it also provides a lot of opportunities for shaping its content by aiming to promote tailored approaches to cardiometabolic care strengthening personalized care for people living with diabetes through very concrete policy recommendations, but also make recommendations on how to use digital and AI tools for earlier intervention, better treatment, access, etc. Timeline-wise, as I mentioned, the council recommendation is expected beyond 2027, so after 2027. So engaging with the commission to understand what this could include, what this could potentially call for and recommend towards the member state. 2026 and 2027 are the key dates. But for this one, there is more time to engage and more time to shape compared to the other two, the national plans and the health checks that I mentioned before. Moving on to another relevant initiative, and that's the last one that I'm going to put the spotlight on. And this is related to stakeholder engagement. The Commission has announced that they will create a network of cardiovascular and diabetes experts. The timeline for that, based on our understanding, is that this will be set up after 2027. But then again, the Commission has recommended to put this network in place, but without having clarity what that network will aim to do. Yet, this means also opportunities for shaping its objectives, participation from the community, and also linking it to the work that the Commission will be doing for some of those policy initiatives, because the benefit of having such a network of experts is to leverage their expertise. We have discussed also with the EUDF how that expertise that will be pulled together could contribute to the work that the Commission is doing, and you can see some of those recommendations on the slide here. This again, the most important thing that I want to highlight is that the thinking of that, also, as I was mentioning for the previous one, is not very mature. Again, sometimes opportunities can also be challenges, but I think here there is a willingness from the Commission to put that network in place of experts. So this is the moment over the next few months to engage with the Commission to understand how that network will be established, when will the call be published for expression of interest, and how it will be used, and what type of expertise will the Commission look to will be looking for. So that was the last one. So to wrap up, I want to take it back a little bit to what are the next steps for at national level. There is the element of the national plans, as mentioned, and this is the opportunity, the number one opportunity for the community here, the development of national plans that have a strong also diabetes focus. Either through the process of the participation in the joint action, or some member states will aim to work on their own. But using the guidance from the EU plan and the existing policy guidance that will stem from the joint actions that will come up, or the existing ones like Zaccardi, that will be key, a key priority for 26 and 27. In that same category for the next two elements, the health checks and the targets. The health checks, because again, that council recommendation that will come later this year will be very crucial in guiding the member states to improve screening and diagnosis. As a reminder, this was also one of the most important documents that stemmed from the European Beating Cancer Plan. It was a council recommendation for screening that was then taken up by member states to be implemented at national level to improve the screening protocols and the screening programs at national level. And with that in mind, how do you create a continuum where you have obviously from health promotion and primary prevention, proper screening and diagnosis, and secondary prevention, all together linked as part of a clear strategy and plan in order to meet certain targets that can then be specific at national level, taking the national context into consideration. And then obviously the additional opportunities that I flagged that are upcoming as well, but they're coming a little bit later. The elements on research, on personalized treatment, the network of experts, and how all of those can be used in order to push for diabetes specific priorities. I think, Bart, I can stop here and pass it over to you to guide us through the rest.
Thank you, Nikos. Thank you also, Professor Mathieu. We are monitoring the Q&A, so I remind you that you can still ask your questions in the Q&A, and then we will tackle the question. But I already received some questions, and one of the questions is, I think I can take it, is what actions will EUDF take in the coming months to support national implementation? And so, again, I think very concretely today we have this webinar. We certainly plan to have another webinar, for instance, on the health checks when there is more to say on that. We will also, during the main conferences, for instance, at the AISD annual meeting, organize a workshop, more of that to come. And in between, we're also planning to organize, like, for instance, a country ambassador network. So I would suggest you follow our website and our LinkedIn, because we will certainly keep you posted there. That said, I think if you have any need for support at country level, please let us know. Maybe another question. Yeah, there is a question on how we will coordinate with the European Society of Cardiology and EASO. Yeah, I think that's a good question. So obviously, on some of the topics that are very concrete, like the health checks, we already worked and work with the ESC and EASO to come up with a kind of proposal that we do from the communities, that, by the way, also includes the kidney community. And so we are actually developing actively a kind of proposal for the Commission to work on. So, and we do still have ongoing meetings, for instance, earlier this week as well with ESC. So yes, there is work going on certainly specific topics. But that said, I think also we need to do our homework as the diabetes community. But I think we will be there very opportunistic and pragmatic. And that's probably also what we want to give to you as a message, that please work together at country level with all stakeholders. But also there are certainly opportunities for collaboration with the other disease communities, because as most of you know, diabetes and obesity and cardiovascular diseases, not diseases that run in isolation. Maybe for you, Professor Mathieu, I have a question that is on the health checks and on screening more in general. So what needs to be built in these health checks to ensure that the screening leads not only to early diagnosis, but I think even more important than to follow up on the results of that? So any idea you have also as a clinician, like what needs to happen after screening, after early diagnosis?
Yes. So the whole exercise of creating awareness, of course, around cardiovascular disease, having multiple contributors to the event is, of course, already very, very important, because it creates awareness in the population, but also with the healthcare professionals that we need to detect. And so
So I can we can come back on that question.
Yeah.
We will give you a few minutes to recuperate. So I have here another question on what are the assets that diabetes must put forward in face of cardiovascular disease. And so is there any communication plan to promote diabetes in the context of that plan? Again, also opening up to you, Nikos, but maybe I can start. So yes, I think since we heard about this cardiovascular plan, I think we have actively engaged to get to make sure that this plan does not only cover the importance of cardiovascular disease, but also recognizes the importance of diabetes and obesity. So I think to some extent that has been successful. I can also refer to the shadow plan that EUDF referred to, and I think Nikos also alluded to it in his presentation. I think it also makes sense to do the same at country level, because I think if there is one, probably the most important message of this webinar is this is a European framework that is offered. And so that means that your country can, if I put it bold, do nothing, or can do the full implementation of the plan. But in that situation, it will also be important at country level to make sure that this plan covers what we call often the triangle of cardiovascular disease, diabetes, and obesity. So you can certainly refer to this shadow plan we developed. You will also be able to use the video we just showed, in which we indeed ask to consider the triad, the triangle of diabetes, obesity, and cardiovascular disease. So I think what is important is, I think Professor Mathieu also said it in the beginning, it is diseases with their own right. So the three diseases are diseases on their own right, but obviously at the same time, diabetes and obesity are also important risk factors for cardiovascular disease. So I think that is important to also highlight at country level. Okay, there is another question, and Professor Mathieu, tell me if you're ready for it. That's more a clinical question, like for the diabetes screening, should we use HbA1c, fasting, plasma glucose, or anything else?
Yeah, let's see. It's a virus, courtesy of my grandson. But I want to come back first of all on the importance of not only doing health checks, but following up on the results. So I think it's very, very important in everything we do that we take all aspects. First of all, awareness creation in the population, awareness creation with the healthcare professionals. Also awareness creation that when you talk about cardiovascular disease, what we don't want is to focus on the end stage diseases. And so when we will talk about the health checks, it will be about early detection of hypertension, of dyslipidemia, and indeed also of diabetes and obesity. And so we're talking about screening in people 35 years and older. So that will be an important message to bring also, that we want to be very proactive. And also that integrated care, as Nikos alluded to, is an integral part of this whole plan. It's not enough to detect people, but also to follow up. And so harnessing our healthcare systems that are sometimes organized in difficult ways, like in Belgium, where we have screening and prevention in the regions, and we have healthcare organized federally. It is important to have all these stakeholders come together and move from awareness, screening, health checks, and then follow up through a good integrated, holistic approach to eventually tackle diabetes, obesity, and prevent cardiovascular disease. On the specifics, so you will see the documents come out. They have been presented. As said, they were put together by experts representing different societies, different forums. For EUDF, we had two representatives who did an amazing job. And for screening, for diabetes, we follow what learned societies say. So you can screen using fasting glycemia, you can screen using hemoglobin A1c. So it depends on how, again, you can embed this in your healthcare system and how you can organize it.
Thank you. We have one more question that is regarding stakeholder engagement. At which stage, whether it's target setting, implementation, monitoring, does EUDF believe patient organizations can have the greatest impact? For me, that's quite an easy question to answer, I think.
For me too.
Yeah, people with diabetes, I think, should be included in any discussion, whether it's on screening, treatment, care, whatever we discuss today. I think that's also how we work in EUDF, and I hope that's also how work will be done at national level. I don't think one stakeholder should be excluded. Same for industry. If it depends on us, I think all stakeholders should ideally discuss this plan together and leverage the opportunities that it brings. So I don't know whether you have any other answer
Yeah, I
to this,
mean,
Mathieu.
it's obvious that those who have the lived experience of diabetes have the strongest voice in this all. And they are the ones who can convince, together with the healthcare professionals, the politicians, that this really needs to be implemented and that the fate of those already living with diabetes needs to improve and that we need to prevent people developing diabetes, developing obesity, and developing cardiovascular disease. And so I applaud also the initiatives of one of our members, the IDF Europe, on, again, informing their local, national, regional patient organizations to start working on this implementation.
Thank you. Okay. Another question I see is on what is missing from this plan. What should institutions and member states prioritize in the next steps? Maybe also, I don't know, Nikos, if you want to add something, but again, if I'm positive, I would say like whatever is missing, probably certainly some more attention to type 1 diabetes and children and young adults, I think would be more positive, I think. However, taking it also from what we try to bring as a message, as that countries can still decide on what to add or what to complement, I still believe there is room for including that also at national level. So, but that's the one aspect I would like to highlight, that also attention for type 1 diabetes, younger people, and how to make sure that we don't forget about this important disease.
Yeah, can I come back to the question of Dr. Hajjaj on communication plans? So we at the EUDF level are developing a lot of tools you locally will be able to use in your different countries. But of course, you will have to translate them. And by that, I don't mean translate into French, but translate to the specifics of your healthcare system. How to bring indeed the attention to obesity, to diabetes specifically. And again, one of the questions was also, what about muzzled, for instance? Again, bring it in. It is important to make it clear that this is now an opportunity for our countries to change the course of metabolic disease, ending in adverse cardiovascular endpoints, but also addressing obesity, diabetes, muzzled, everything together. And again, we will be elaborating tools that you will be able to use, translatable into your own countries. Again, also IDF Europe will be developing tools specifically then for patient organizations. So yeah, very important.
And if I may, Bart, to the question, what is missing? There is the perspective from which we're looking at it. If someone takes the plan and compares it with the Europe's Beating Cancer Plan, they will say it's lacking in various ways. If you compare it with the mental health communication, it's a much stronger document. But at the end of the day, regardless of the how much is included, what is touched upon, etc., in that document. That document is just, as we were saying, it's just the start. It's a framework for upcoming activities that can be shaped. And as Professor Mathieu was saying, there's a lot of opportunity. So that bring it on. That engage now with at national level, at European level, to shape all of those initiatives and include the asks But and engage, because there was a question about not just about assets, but also when to engage before anything is drafted. Engage the earlier you can.
Thank you, Nikos. I think it's time to conclude, if you allow me. So just the last couple of minutes. So I think we learned today that the Safe Hearts Plan matters for diabetes. It recognizes clearly also diabetes and obesity as diseases that also are diseases, but also at the same time risk factors. We have learned about the pillars of prevention, early detection, screening, but then obviously also treatment and care. But I think the key message today was that this EU Safe Hearts Plan will need to be translated and implemented at country level. And we will need all of you to leverage the opportunities for people living with diabetes. Here you see again a summary of what we discussed, concrete actions that you can discuss at country level. So practically, we recommend you to come together also in your country, discuss and align with any stakeholder, as we just discussed. And also after that, of course, there will be a need to engage and to go out to your policymakers and see what makes most sense for your country. So I think collaboration will be key, as some of you discussed, not only within the diabetes community, but probably also with our friends from the obesity and cardio community. And so with that, I obviously want to thank the speakers. Professor Mathieu, thank you for being with us. Also, Nikos and the Acumen team with Arya and Marge, and also Kasia working on the webinar. And of course, last but not least, also the audience for joining us. So we will probably organize another webinar, as we mentioned, on health checks. So please keep our LinkedIn and our website on your radar. And again, thank you very much for joining us today.